Hi, and welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Pho, founder and editor of KevinMD. Today on the show, we have Avital O'Glasser. She is an internal medicine physician and she co-wrote the KevinMD article, The COVID-19 Pandemic Brought Many New Challenges in Medicine. A novel tool may help to overcome some of them. Avital, welcome to the show.
Thank you so much for having me. It's a pleasure.
We'll get into the article that you co-wrote in a little bit, but first off, can you share your story and your journey to where you are today?
Sure. So I am an attending physician in Portland, Oregon. I'm a hospitalist who is in a very unique practice setting. I practice outpatient in our preoperative medicine clinic, which I have the privilege of being the medical director for. And I like to say that I've had a healthy dose of serendipity and mentorship through my journey to this point. Did not enter college thinking that I was going to pursue a career in medicine, and then was able to tap in and identify that passion. Finished residency on a career pathway that is not the career pathway that I'm on right now. Again, thanks to a set of circumstances as well as some failures. But I feel through connections and being in tune with mentors and opportunities, I'm just thrilled to be able to practice perioperative medicine and within a multidisciplinary community.
So through your lens as in perioperative medicine and what you do in the past year, just describe what you've been seeing.
Oh my goodness, we've had quite a year through perioperative medicine. And I even recall probably a year ago exactly, as the first couple of cases were being diagnosed in Oregon, and we were just wondering what the next days to weeks had in store for us, wondering how COVID-19 and the pandemic would affect our workflows beyond trying to strategize about sick leaves or employee exposures. But we've been very busy in the last year, ranging from shifting an entire clinic to telehealth in response to the pandemic, to launching an entire screening program for pre-surgery or pre-procedure, pre-anesthesia COVID testing, COVID swabs. We've done almost 25,000 COVID swabs in our pre-op clinic alone in the last year. And my current research and academic interest as it pertains to COVID is understanding when a survivor of COVID, symptomatic or asymptomatic infection, is medically stable to undergo surgery, given all that we know about the short-term and long-term harm of COVID.
So go into a little more detail on that. So I'm sure we've learned a lot in the past year on that. So we're speaking in the beginning of March. So what are some of the factors that we need to consider when clearing a patient preoperatively for surgery?
Yeah, so if someone had a garden variety upper respiratory infection, or even had something more serious like the flu, we would want to slow down and make sure that they were ready for an elective surgery at that time and place. How have they recovered? Are they back to feeling 100%? How is their lung function? What is their risk of being intubated or having a complication of the surgery from that acute illness? And one of the major things that we've learned about COVID in the last year is that it is far more than a garden variety upper respiratory infection, that maybe not in every patient, but in a sizable number of patients, including patients who didn't realize they had the infection, there's a lot of long-term damage, both long-term fatigue or other symptoms, this long COVID syndrome. A large percentage of patients in some studies are being found to have silent cardiac damage, potential for kidney damage, abnormal clotting. And we started exploring, my group and I started exploring the question of how do we know if a COVID survivor is as safe as possible for a surgery, probably around Memorial Day of last year, trying to draw from all of these analogies outside of the surgical setting to within the surgical setting, drawing analogies from recovering from a heart attack before surgery, recovering from a stroke, recovering from a pneumonia. And what we have found is that we have created and implemented a protocol to really slow down, ask a lot of questions, take a very good history and physical, and also use EKG, blood work to try to help build a picture of a patient's risk before surgery.
All right, so let's transition now into the KevinMD article that you co-wrote with Vineet Arora and Shikha Jain. It's titled, The COVID-19 Pandemic Brought Many New Challenges in Medicine. A novel tool may help overcome some of them. Now, for those who didn't read the article, can you just walk my audience through it and share the story why you and your co-authors decided to write it?
Absolutely. So I've been working with this wonderful team of other women in medicine, as well as some he for she men in medicine. And we've connected for over a year on the question of how do we help women, underrepresented minorities, students, really anyone in medicine articulate their impact and reach. I'm at an academic institution and have been part of discussions for several years that the longstanding currency of academic medicine, publications in peer-reviewed journals, followed by conference presentations, invited lectures, is an important part of driving our fields forward. But should it be the be-all and end-all of academic currency and weighting a CV or the promotion and tenure process? So this was the foundation, this sort of shaking up the paradigm. And then when the pandemic hit, and especially women, not only women, but especially women were bearing the brunt of shifting responsibilities, quarantining, childcare, family responsibilities, both in medicine and outside of medicine. There was already data quickly emerging that women were taking a very disproportionate brunt of the screeching halt that academia, both medicine and science and other fields, were experiencing. And as a clinician leader, where service, contribution, innovation is also the currency that drives healthcare forward, we rose to the challenge of trying to help our colleagues articulate the work that they were doing, both the disruptions due to COVID. Did your research lab get shut down? Did your conference presentations get canceled? Did your manuscript drafting stall because everyone got pulled into inpatient care because of the surge? And then what also were you doing? Did you rapidly step up and become a service director, or create a new workflow, or a chair or a response committee at your institution? So trying to articulate the breadth and depth of how we dramatically pivoted and impacted our professional communities during the pandemic. So that's the piece. So again, our group had been focusing on the CV itself, the curriculum vitae or the resume, as a tool to articulate modern 21st century impacts in medicine and academia. So we created a matrix to articulate categories of contributions to the fields during the COVID-19 pandemic. And we were able to publish a couple pieces about it, and then we wrote the KevinMD piece as well, laying out the background information, as well as some of our recommended strategies and talking points.
So you talk about publications being the currency for advancing in academia. Can you paint me a picture of some of the disparities within that factor?
One of the disparities that we've highlighted is that if you are a clinician educator, so if you are almost full-time taking care of patients in the clinic setting or in the hospital setting or some combination of both, much of your research time is really on your own time. It's on your free time. It may not be funded through an NIH grant or other grant money. So it's already work above and beyond the work you're paid to do. And when clinicians all over the world stepped up to the challenges of caring for COVID and mobilizing the response to the early surges, that time became even more constrained. So if you were an innovative clinician or innovative clinician educator, but couldn't articulate that through a publication, how could you articulate to your boss, to a future job application, to a promotion committee, that you were making dramatic contributions to the field? So that's one example.
So tell me about some of the details in this new matrix that you created for the CV. What are some of these other factors that you're talking about?
So we're talking about, one of the categories is research itself, or traditional scholarly output. So did you have scheduled presentations or visiting lectures that were interrupted? Were you actually able to pivot and capture the work you did or the quality improvement research you did into a rapid publication? So both sort of like articulating, I don't say the negative, but like the losses and the gains due to COVID. were you engaged in volunteerism or service? A lot of the responses in medicine to the pandemic were volunteer positions, people stepping up to the plate in multiple ways. Were you engaged in advocacy? I'm very passionate about physician or clinician-led advocacy. And that's one of the things that I'm passionate about, helping individuals articulate on their CV, that it doesn't, research is not the only way that we can move a field and improve patient outcomes, but political advocacy, public health advocacy, and there was a lot of advocacy that was required during COVID, starting with even get me PPE or wear a mask or socially or physically distance campaigns. Were there other constraints? Were you both simultaneously leading your division and helping your kids with virtual schooling? Mm-hmm. And we've created a matrix to articulate different categories of both sort of the loss and the additions.
So walk me through this tool itself. So if I was a clinician who wanted to click on this tool and incorporate some of the things that you talked about, how would that work?
So we're advocating a sort of a grid-like structure that could be added as an addendum to your CV or saved as a living, breathing document. Again, we are a year into this pandemic, and so the work is ongoing. It's not just the work that people did in March, April, and maybe May of last year. So we have published this through the Explore the Space and Women in Medicine Summit websites. It is also included in a recent Journal of Hospital Medicine publication. Those hyperlinks are in the KevinMD piece.
So one of the things that I have on my blog, and people have written about this, is that we want to get away from publications being the sole academic currency, as you put it. And some people have asked me, do social media activities, do social media articles, can that count as well? How much do you see something like this moving the needle, knowing how notoriously slow medicine is to adapt?
I'm cautiously optimistic that we will move the needle in that regard. And that was actually the work I was doing before the pandemic. So this is some of my own background and passions in this area. I'm not a traditional researcher. I've done some quality improvement research. I've done some publications, but I like to joke that my mom never thought I'd be a rebel with a cause, but I was working a lot and participating in a lot of these conversations to champion, air quotes, novel or non-traditional scholarship. And I think social media-based scholarship or scholarly teaching is here to stay in medicine. You can take a podcast and say thousands of people have downloaded this episode. That was a very robust clinical topic, maybe an hour-long subject. And a conference presentation may get weighted more heavily, but if 100 people heard it at a conference, but thousands of people listened to the podcast, how do we reconcile that those are weighted differently? And how can we elevate the discussion about elevating and counting social media-based scholarship? If you are doing novel, impactful, scholarly teaching through your social media platform, I have friends who write tutorials that are fantastic versions of Chalk Talk or 5-minute, 10-minute teaching. Dr. Tony Brew has published about this in the New England Journal itself, that we are elevating a form of teaching adults in the 21st century. If you are using your social media platform, be it Twitter or podcast or blogs, to engage in meaningful advocacy, Shika and Vinny are very active in the Impact organization out of Illinois, which has done amazing work with advocacy and protection of patients and health professionals in the last year. So I really hope that we will move the needle. I think we are. I think we're at the 5 or 6 year mark of the Mayo Clinic announcing that their promotion and tenure process would include assessment of social media based activities. And the documents they put out to the public talked about our duty as clinicians to teach, and social media based activities are one way to teach our colleagues and the public. So I'm excited, and I actually wonder how much the last year of the pandemic will help us continue to move that needle based on the impactful work that people have done outside of the traditional research setting.
We're talking to Avital O'Glasser. She is an internal medicine physician, and she co-wrote the KevinMD article, "The COVID-19 Pandemic Brought Many New Challenges in Medicine. A Novel Tool May Help Overcome Some of Them." Avi, you mentioned the Mayo Clinic being one
Uh-huh.
institution that includes non-traditional research as part of the advancement process. Just give me a sense, what proportion of medical institutions currently use these non-traditional avenues and weight them when they consider academic promotion?
I don't have a specific number or percentage, but my ears to the ground tells me that more institutions are at least engaging in those discussions about what should be included. I'm thrilled. I know that our institution has already taken this metric and has at least discussed it amongst the members of the P&T committee. Sometimes medicine changes slowly. We've changed so much in
Mhm.
the last year alone. But I think if we continue to chip away at this, then maybe we will reach a critical mass of institutions in the near future.
And so far, what's been the response to your efforts in this article?
I would say it's been positive. I feel very appreciative of the fact that I can give colleagues a voice amidst a very challenging year, and I think we have been inspired in a very she for she way to do this, but it does not restrict itself to women. I want to acknowledge that we have men and gender non-binary colleagues who also have had to pivot dramatically in their lives and their careers in the last year, and I think these lessons are also applicable to underrepresented minorities and disadvantaged colleagues within medicine. There's a line, Dr. Sasha Chilcutt and Dr. Julie Silver have a
Mhm.
piece from a couple of years ago in the New England Journal, also about the use of social media, specifically for its benefit for women. But I think you can draw a lot of parallels that the traditional hierarchical structure of medicine for decades, if not hundreds of years, has disproportionately given some people voices, and then that gets you a seat at the table at a conference. It gets you on a panel. It gets you into a committee role. It gets you into a leadership position at your institution or in a professional society at the national level. And by giving people a non-traditional voice, I hope that we will have many more impactful voices at the conversations. So the fact that I can help, again, I talked about the power of advocacy and articulating that advocacy is an important contribution to the field on your CV. I find this kind of work thrilling and invigorating because it is a form of advocacy for my peers and colleagues.
And my final question, what's your take-home message you want to leave with the KevinMD audience?
I think my take home message is that creativity and growth mindsets will get us far as citizens of the world and in medicine and in science. Again, I like that we're shaking up the conversation in a way that advances our colleagues and our peers. And it's actually been really, really, after a very stressful year, creative in this regard to challenge paradigms is one of the things that gets me out of bed in the morning.
Well, thank you so much for sharing your time and insight. And thanks again for being on the show.
Thank you so much.